To introduce Heidi Haynes. I know a number of you know Heidi. She's Director of Advocacy for the ARC of Colorado. Has been for the last 2 years very much involved in self-advocacy movements. And she's going to give us an update of what we're looking toward with this legislative session. So Heidi, thanks.
Thank you, Corey. Okay, awesome. So let's see, it's December, which means that the legislative session is going to be starting very soon, less than a month to go. So each year, the ARC of Colorado is not like the other local chapters in Colorado because we don't do a lot of direct advocacy. Like Carol Meredith is here from the ARC of Arapahoe Douglas, and if you live in Arapahoe or Douglas counties, you would go to the ARC and you would maybe be able to get an educational advocate. They also do adult advocacy. The ARC of Colorado, what we do is we work a lot more on systems advocacy. So we are very busy through the whole legislative session, especially, but for the rest of the year, we are on a lot of committees and we go to a lot of stakeholder meetings. And one of the things that we do every year is we create a public policy agenda, but we do that with all of the local chapters. So usually the public policy agenda is kind of guardrails for us as we go through the session because we don't really know what's going to pop up or what's going to happen. I know last year we were all caught off guard because there was a bill suddenly to declare autism an epidemic in the state of Colorado. So we kind of had to scramble, but it's nice to be able to look to our public policy agenda to be able to say, well, is this really what we all agreed we wanted to work on this year? And a lot of times other groups will come and say, can you help us support this? And of course, it's always a good idea. But anyway, this agenda kind of exists so that we can look at it and say, does this really fit in with what we want to do? So there's 3 main parts of the public policy agenda for this year. The first one is funding and policy changes to strengthen the Colorado Medicaid state plan, state programs, and the HCBS Medicaid waivers for people with disabilities to include support for. So what we'd like to see are changes in Colorado statute where needed to comply with the requirements established in federal law for HCBS, home and community-based services, therapeutic out-of-home placement and intensive treatment options for children with IDD and dual diagnosis. So that was what we were talking about right before this. Full implementation of Colorado's Olmstead Plan, including implementation of strategies for integrated competitive employment. We think that's going to be a big one this year, and that was a bill that we worked on. We've been working on it kind of through each session, but we're hoping to make some more progress this year, possibly even creating a office, like a formal office for that. Increased standards for health, fire, and safety as they pertain to IRS settings. So last year there was some movement around around creating new regulations in host homes after the deadly host home fire that had happened 2 years ago, but nothing happened there. So that's what that's referring to. Additional resources to be allocated for the implementation of Employment First in Colorado. I just want to click it. Oh, okay. There we go. Oh, no, I went back too far. Forgive me. Okay, we're good now. So, and then we have more that are in the same category, which includes increased funding for respite and other services needed to maintain family stability. You know, respite's kind of something that comes up every year, and it's obviously a huge issue here in Colorado, and we are always looking at ways to improve access to respite. Expansion of the cross-system behavioral health crisis pilots. That's another thing we've talked about a lot during CANDO meetings. Consistent standards for enrollment in HCBS long-term supports and services for emergency cases. Accelerated Medicaid waiver simplification with the purpose of creating single, easily accessible HCBS waivers for all eligible children and all eligible adults with IDD. Each waiver should further access to quality services and supports when and where needed throughout their lifetimes. So that's what Carol was talking about a little bit ago, waiver simplification. Increased supported living services and waiver levels with rate increase. So even though we don't officially have a SLS waitlist here in Colorado, it depends who you ask, we know that a lot of CCBs have, people are still waiting for services, and there's a lot of reasons for that. One of them is that they can't find providers that will take on the clients with the rates. Consumer and participant directed services in all HCBS long-term services and supports waivers. Does anybody have any questions about these ones? Okay. So in our next category, it's Colorado students with disabilities have a legal right to free, appropriate, and inclusive educational opportunities in all settings within the least restrictive environment. Colorado must provide for adequate funding for public schools for inclusive student-centered programs for all students, alternatives to harmful disciplinary practices such as suspension and expulsion for young students, and requirements that schools to work towards de-escalating minor school infractions rather than call police department for assistance. This was a bill a few years ago. Nothing got ran last year, but we think that we're going to be successful, especially considering the political climate, getting a bill through this year that will take care of some of that. Expansion of inclusive higher education programs in the Denver metro area and along the Western Slope, and encourage future and current programs to attract and support degree-seeking students. So we're going to continue to support that. We've had a few meetings already this year working on stuff for this session. Elimination of corporal punishment in public schools that receive federal funding. This one, Colorado is a local control state, so right now districts have been resistant to, some districts have been resistant to a statewide bill that would control how they do things in their counties. So but we're still going to try and do something. Special education services provided in the least restrictive and most inclusive setting by qualified teachers, staff, and therapists for all eligible students, including appropriate continuum of services, paraprofessional support, and related supports, including transportation. Yeah. Oh.
So I have children with disabilities, and this one's really resonating with me. It's wonderful. So when you're talking about, providing those supports, paraprofessionals, right now, as you said, Colorado being a local, what is it?
Yeah,
local control.
Right, yeah.
Right now, the school is having to provide these, and that makes a child look higher needs than others because of, the school resources being used up in paraprofessionals. Are you saying that there might be special education services that might come from other funding sources besides the school?
I wouldn't necessarily say that. I think I would say that we would hope that all schools were adequately funded so that they don't always make that argument that they don't have the funding. I think our position is that they are still federally required to provide certain services and supports, and we often hear, I'll use an example that I heard recently, like, well, we don't have resources for that. We have our gym teacher teaching math. Like, we don't have any money for that. So I think what we're saying is that we really want to support schools being adequately funded so that that's not an issue. Because the way we look at it is that's not an excuse right now. Like, that doesn't take away your responsibility to provide services, appropriate services and supports to make sure that that student is receiving a free and appropriate public education. Does that answer your question? Okay, we worked really hard on the recent school funding bill that was just defeated, but one of the reasons that we kind of took that on as one of our issues was that we really do believe that the schools need the resources to be able to do that, because it is frustrating. It is frustrating when they say we just can't do that, and we're like, but you're required to. I mean, it's kind of, it's a catch-22, and we'd like to at least see some of that eliminated where possible. You're welcome. Okay, we have more for school. Kind of along the same lines as what we were just talking about, adequate medical, nursing, and behavioral support services with appropriate staffing for students with complex needs. So we hear that a lot too, like a lot, oftentimes with suspension in cases where they kind of, kids end up getting suspended because, and they're out of school suspensions, and they're like, well, we don't have anyone to deal with this here in the school. Meaningful transition services for students with disability that are person-centered and that prepare them for continuing education and/or work-based experiences, resulting in competitive, integrative employment and successful community living. So last year there was a bill passed. It was Senate Bill 18231, which was a transition stakeholder. It created a stakeholder group for transition. It was like a task force. And so we have someone in our office, Abigail Nagley, who's been working very closely on that particular project. So we're hoping that they'll come up with some recommendations that we can put into some bills and get those passed. Achieve equal access to appropriate supports and services and publicly funded education services for students age birth through 21. So kind of along that, I don't know if any of you had heard that the Colorado Department of Education was trying to they were trying to create an alternative diploma option for students. So the ARC of Colorado and all of our chapters came out, and we opposed that. They wanted to create, along with alternative assessments, they wanted to create an alternative diploma for students and with intellectual and developmental disabilities. So if you have any questions about that, I've got my cards, but my contact info is also on the end. We wrote a letter to the Colorado Department of Education. And anyway, if you have any questions, let me know, because we really want to make sure that they hear from people about that. So the third category we have is protection of civil rights for people with disabilities, including, so sorry, and I don't mean to just read this to you guys, but I want to make sure that I get you the accurate information since it's representing so many chapters. Promoting alternatives, healthcare proxies, advanced directives, supported decision-making powers of attorney, notarized statements, representation agreements, etc., in favor of permanent, restrictive, protective arrangements. Guardianship policies should respect the rights of people with disabilities to manage their own affairs with informal assistance and guidance from family, friends, and others. If guardianship is essential, it should be limited to the fewest restrictions necessary for the shortest amount of time and tailored to the individual's specific capacities and needs, always with the presumption in favor of limited rather than full guardianship. Policies for representatives of people with IDD to ensure that the needs and choices of people are respected and honored. School discipline policies that provide positive behavioral supports for students with disabilities that minimize seclusion, restraint, and involvement of law enforcement. And appropriate accommodations and modifications to support individuals with disabilities in the criminal justice system. So I'm gonna, we normally, I think we do this for the advisory committee in January, and by that time we usually have some idea of what bills are coming up, and we've already decided to support or oppose or be neutral. But right now we don't have any bill titles or bill names that we know of yet. So when the session starts, I wanted to let you all know, and I have cards so you can email me, but we have a link to something called Capital Watch, and that shows our lobbyist kind of keeps it up to date for us, but it shows all the bills that we're tracking. So if we're strongly support, oppose, or strongly oppose, it's all listed on there, and then you're able to kind of track along during the session what's happening to that bill. And last year we created a really great service where we were actually able to have people sign up to come testify. So if there's something that's really important, or you feel like you have something to say, we actually have a way that you can sign up and come testify for it if you wanted to with us. Obviously you can do that anytime on your own, but it seemed to work out well. So here's my contact information. I also have cards, but our website is thearcofco.org. And then I also wanted to tell you, we're having a website redesign this year, and one of the things that we're going to be able to do is have people from all over Colorado sign up, and then we'll be able to really drill down when we have a bill come up where we need like one person to vote a certain way. So we would even be able to say, like, you live in this district, please contact Senator such and such, and let them know that you support this bill. So we're very excited about that. I think there's going to be lots of different ways that we can really engage people and get information out to people that need it. Another really great thing that we're doing this legislative session, we got the blessing of AUCD. They do Tuesdays with Liz. Liz Weintraub does Public Policy for All, and that's a national like thing she does on YouTube. It's amazing. But they agreed that we could try and do kind of a prototype here in Colorado. So we are going to sit down with Stone, and it's with Stone Anderson, and he is a local self-advocate, and he's actually going to interview policymakers here in Colorado. And the first person, we've already gotten Jessie Danielson, who was she's a senator-elect now. She was a representative, but she's agreed to be his first interview. So we'll be able to kind of do that, and we're really excited because I think that we'll be able to push that out, and then self-advocates and everyone really, because it's an intimidating process, but they'll kind of be able to get some of that demystified and hopefully feel more comfortable going down and sharing their own stories, because I think that those are the most effective and important for legislators to hear. Not for the first one yet, but stay tuned, and I'll let you know, because I mean, since it's kind of a you said thing, we'll definitely want you guys to be able to help us push that out. So we're really excited. You got to see Stone's interview where he interviewed us at the board meeting. Did you see that? Oh, okay. Yeah, he did his first interview. We let him practice on the staff of the Arc of Colorado, and he's really good at it. He's better than I could have ever imagined. So, all right. Does anybody have any questions? Okay. And again, sorry for just reading that to you, but I just always want to make sure, since it's such a carefully worded and reviewed thing, that I really don't misrepresent it. So, all right. Thank you. Thank you.
I want to take this opportunity to thank Christine and Dina for their amazing technical skills of keeping us going with this more than usual complex program. So we really appreciate it. So for the last bit of our agenda today, we're going to be hearing from two folks about building statewide capacity for children's mental health. And our first presenter is someone, for those familiar with CANDO, have heard before, Sarah Davidon, who's assistant professor here at University of Colorado School of Medicine, and also a role that she's assumed over the past year and a half now, with Mental Health Colorado. So we've heard from Sarah before on ways of looking at mental health, children's mental health and capacity, and happy to hear from her again this morning.
Hi, everybody. How many people do we have on the web? 14. Oh, good. Well, hi, everybody on the web. So I have, as Corey said, talked about mental health with CANDO before. So I'm gonna, one, try not to be redundant, and two, I think I've got the ability to do that because we have some great sort of new resources that we're gonna be talking about that are a little bit different than what we've been able to sort of discuss in the past about what's been available in capacity for providing services for children's mental health. So as Corey mentioned, I am here at JFK Partners, but I also am over at Mental Health Colorado as the research director there, and I also am sort of leading our child and adolescent strategy. So have been working on school-based mental health, kind of strategy and resource development and capacity building, as well as early childhood mental health. So wanted to talk today about an opportunity that we were very fortunate to be able to partner with the children's, so Partners for Children's Mental Health at Children's Hospital to apply for and receive funding from the State Attorney General this year, actually just in, I think, was it October, September, October-ish? The announcement was made in November. For really some targeted funding to build some resources for children's mental health in our state. So I'm going to go sort of a little bit into kind of what we mean by children's mental health and kind of how we're defining that. But then I'll talk about our role in that with Mental Health Colorado, and ours is specifically going to be focused on school-based mental health. And then pass it over to Antonio about the work that Partners for Children's Mental Health is going to be doing. So we'll do a little dog and pony show for you. Good thing that wasn't on my dissertation, learning to do that. Yep, zeros. So I thought I'd start just by doing some level setting about how we're defining mental health, and particularly children's mental health. So mental health in childhood and adolescence, we're defining as sort of reaching developmental and emotional milestones, learning healthy social skills and learning how to cope when there are difficulties, kind of resilience, bouncing back in the face of adversity, and being able to show things like empathy. And I think often when we talk about mental health, people automatically go to mental illness. But we really want to sort of reinforce that mental health doesn't just mean the absence of illness. It really, I mean, if we think about physical health, we don't sort of go directly to thinking about cancer or diabetes. We think about, you know, exercise and nutrition and sort of some of those wellness things. And so I really encourage all of us to think about mental health in the same way, that it's about health and wellness and not just illness or the absence of illness. So that's mental health, but mental health disorders or mental illness do exist, and they exist in children, you know, as young as, you know, 6 months, a year old. So when we think about mental health, we need to think about the continuum of ages. And when we think about mental illness or mental health disorders, we also need to think about children, that there can be diagnosed mental illness or mental health disorders in very young children as well. And we've got some specific tools that can much better assess that. So looking at sort of a diagnostic and assessment system for children age birth through 5 is very appropriate, rather than looking at sort of diagnostic tools for older adolescents or adults. So mental health disorders among children, when we think about that, we can think about sort of serious changes in the way that children learn or behave or handle their emotions, that can cause sort of a duration of distress and problems getting through the day, and not just having one bad day, but really sort of that there's some acuity to it, and there's also some duration to how it's interfering with kids' lives. So often they go untreated, but are very treatable. Unfortunately, from the onset of symptoms of a mental health disorder to treatment is often an 8 to 10 year gap. So we're, yeah, Carol, you shouldn't be surprised by this. So research shows that there's an 8 to 10 year gap from onset of symptoms of a mental health disorder to actually receiving treatment. And that's just for those who actually get treatment. So then there's also a population who never are able to access treatment. So our partnership through this Attorney General's funding and our partnership with Partners for Children's Mental Health was really to help close that gap. And you can correct me if I'm wrong if there are other reasons, but I would say if we want to come to the sort of the bottom line, that gap is caused by things like inadequate network of providers, inadequate access to resources in home communities, funding issues, cost barriers, things like that. So we're really wanting to address those issues that are causing that 8 to 10 year gap in access to care. So again, another sort of little bit of level setting, so we're all sort of thinking about this in the same way. We know that approximately 1 in 5 children and adolescents between the ages of about 13 and 18 experience a severe mental illness. So that's not just kind of having sort of a situational depression or something like that, but this is really sort of a diagnosed and serious mental illness. So about 1 in 5 youth. So if you think about any room that you've been in where there have been kids or adolescents in it, chances are a significant number of them have a diagnosable mental illness or mental health disorder. Usually symptoms are appearing by about age 14 in that 1 in 5 who have a mental illness. About 3/4 of symptoms are appearing by age 24. So really in sort of that childhood and adolescence is the place to catch about 3/4 of mental health disorders or mental health issues. So school and childhood and adolescence and the places where those kids and families are is really the place that we want to focus. So pediatric practices, well child visits, schools, things like that. Again, just to sort of help you understand where Colorado is in ranking. So Mental Health America just came out with new rankings of states. If you haven't seen Mental Health America's rankings, so Mental Health Colorado is the Colorado affiliate of Mental Health America. So we are closely following the data that comes out of Mental Health America because they're able to aggregate from a number of sources, like from the CDC and National Institutes for Mental Health. And so Mental Health America ranks states based on a number of factors, including youth measures. So here in Colorado, the state has actually shown improvement from the last year's ranking to this year. So last year, Colorado ranked 48th in the nation for children's mental health. So that looks at factors like not just major depressive episodes or sort of diagnosed conditions, because prevalence alone I don't think should be a negative factor. I mean, that might mean we're doing a better job at identifying, but it also includes things like access to care, youth who have sort of severe depression, who have been able to receive services or haven't been able to receive services, or inconsistency in treatment. So it looks at some other factors as well. So Colorado had ranked 48th last year. We're now up to 33rd. But I also want to point out, I mean, I don't want to be like, Debbie Downer, but the year before, Colorado was 29th. So we went 29th to 48th to 33rd. So we're kind of all over the place, but we're still lower than we were 2 years ago. So yes, I'm happy that we've gone from 48th to 33rd, and there's still work to do. So suicide rate is just one factor in a series of, I think there are 8, there are 1, 2, 3, 4, 5, 6, 7, 8 factors that are included in this. So our suicide ranking, so we're now 9th in the nation for suicide. So we're right up there. Yeah, sometimes it's not good to be at the top of the list. So suicide is just part of the criteria looked at. So it also includes sort of an adequacy of a network of care and appropriate providers and things like that. Last year, yes. Yes. If you look at 2 years ago, though, we were 29th. So, I mean, it also could be that, I mean, whenever you look at rankings, you need to sort of, to some degree, take it with a grain of salt. But we're not first. How's that? We want to be first. I want to be, not in suicide rate, but we want to be first in our ranking on how well children can access the care that they need. So what Mental Health Colorado is doing in this partnership is we're focusing on school mental health supports and resources. So what can we do to help schools sort of better understand the array of comprehensive services that need to be available in schools, so that that can help them as they are passing ballot initiatives and mill levies and have sort of school district funding that can be dedicated to mental health, which a number of schools have now, as schools are paying more and more attention to sort of school safety and climate and culture. They're realizing that part of climate and culture and school safety is around mental health. So what we've done is to look at sort of these, what are 4 things that schools can do to more adequately support the mental health needs of students and the staff in schools as well. So we're looking at teacher wellness. So we think 1 is a comprehensive approach that includes key mental health components, and we've developed a toolkit around this. The second is promotion of emotional well-being and connectedness. I mean, students who have a trusted person are far more likely to go to that person rather than turn to sort of substance use or violence for problem solving. Identification of students at risk is an important role of schools, and having timely resources and being prepared to respond. So sort of those are the 4 categories of things that we want to help schools do better on. And when we have some schools, and I mean, that are peppered around the state, we have some districts that are really doing some of these things well, and some that really need some help and support and are acknowledging that. So we developed our school mental health toolkit, and this is really sort of where the funding that we're receiving from this Attorney General's grant. So we've already done some work on the toolkit. The toolkit is developed. We've already started rolling out to schools. We have 10 districts who have adopted this. We have 10 more who are in process of adopting it. But Colorado has 178 school districts. So we just didn't have the capacity to keep going with this with one person, that would be me, doing this. Yeah. So DPS, so I've been working with Denver Public Schools on some of the best practices and what DPS is doing. The question was, has Denver Public Schools adopted this? And what they've done is they've gone through sort of this assessment tool that I'll show you. And they're using the best practice strategies in the toolkit to work with individual schools, to then sort of work with the school psychologists and social workers in the schools to help frame how at the school level or at the building level, how mental health services can look. So as a district, there hasn't been sort of a formal statement of adoption, but we've worked with some of the key partners in DPS, and they're using it as a framework for how they do sort of their building level school mental health work. Yeah. So the question is, should I just repeat the question? Is that no, I don't mind at all. So the question is, are there districts on the western slope? So I've been trying to reach out to the Mesa School District, and one of our board members has a good connection there, and so trying to do that. Most of them have been in some of the rural communities, but not quite as far out as the western slope. So we're working with Roaring Forks, or actually it's Roaring Fork. There's only one fork. There aren't multiple forks, really. So Roaring Fork, Fairplay RE2 in Park County. We've done some work in Manitou Springs in El Paso County. We've done some work in, I can't name them all off the top of my head, but I'd be happy to share a list. But anywhere, I mean, these questions are good, and I would encourage you that anywhere you might have a connection with a district, we really want to hear about that, because part of the capacity building that we have the opportunity to do with this grant is I'm going to be hiring somebody to do more targeted work with districts, so that because I just can't. I mean, I'm kind of flying the plane and building it, and so I've been working with some of the statewide kind of membership organizations, the Colorado Association of School Boards, the Colorado Association of School Executives, the Rural Schools Alliance, the Colorado Association of School-Based Health Centers, and all of those C words. Right. But so there are actually 10 different statewide membership organizations that I've been working with to implement the toolkit, thinking that those would be sort of good entities for then it to trickle down to their membership. I also had the opportunity to meet with 20 Southern Colorado school superintendents a month or so ago, and went through all of the best practices in the toolkit. And there was not one superintendent in that room of about 20 superintendents who said, well, that's a bad idea, which was good, because that could have happened. And it was a real mix. It was a political mix. It was sort of a very sort of different, I mean, rural school districts, things happen differently in some of our very rural school districts. But there was consistent agreement and support of these 10 best practices in school mental health. And the question was just, how do we fund it? How do we get there? So that's why we developed the toolkit. So many schools have, various priorities, but one thing that we've heard bubble up has been, how do we address mental health, knowing that our teachers aren't clinicians? How do we address mental health in schools with limited resources? But also it's kind of a daunting task. Everybody wants to sell us a curriculum or, download their latest, screening tool or assessment tool or suicide risk assessment protocol. And how do we know how to sort of go through this decision making? So our goal is to help schools in that decision making. So we don't have a program, we don't have a curriculum, we don't have a screening tool. It's just, here's a framework for best practices. And if you want to find the toolkit is free and downloadable. It includes like funding strategies and advocacy tips and details about these 10 best practices. So you can download it from mentalhealthcolorado.org/school toolkit. So it really is, the intent is to have a comprehensive, in every single district in our state, to have them adopt a comprehensive approach to mental health that includes the 10 best practices that I'm going to go through. So as I mentioned, so through this partnership with the Children's Hospital Foundation and Partners for Children's Mental Health Colorado has this opportunity now to really become sort of more robust in our expansion of the school mental health toolkit. So that includes our ability to work more directly with communities and school districts, rather than sort of this kind of balcony level work that I have worked with some districts, but it's just, I can't get to all 178 districts, 1,888 schools in our state. And yes, I have that at the top of my head. So it's to enhance our ability to work directly with schools by hiring people, by doing some more sort of online kind of a materials development and resource development, and also providing some kind of incentive grants or mini grants to school districts or communities to adopt some of these practices. So we have 3 components of our Mental Health Colorado school mental health expansion work, but then as I said, Antonio's going to talk about the Partners for Children's Mental Health components of this work. So just keep in mind that this is just a component of the Attorney General's grant around children's mental health. So the 3 components are: 1, public engagement. So we're trying to better identify community mental health liaisons or specialists who can sort of be the local on the ground lead to work with school districts to adopt these 10 best practices in school mental health and help them, find funding and kind of do some barrier busting if there's some challenges to implementation. And we're also going to pair our brainwave advocacy network. So Mental Health Colorado has over 700 people across the state, covering every House district in our state, who are our network of advocates to help work locally around adoption of best practices, but also, you know, helping to impact policy change. So if there are issues that we're working on, like one of the strategies that we have now is to increase the capacity of what we have in Colorado that's called the School Health Professional Grant Program. And so we're working with some policymakers around expansion and enhancement of that program so that it can better support mental health in schools. And so our brainwave advocates will be a network that we'll go to do some local work to sort of help them better understand what we're trying to do, but then also to have it sort of bubble up to them talking to their legislators about the initiative. So the first is public engagement. So the second is implementation. So implementation is, so our work is going to be providing support and consultation through this new hire to community mental health specialists in the communities and to school districts by helping them with funding strategies and overcoming barriers and understanding these 10 best practices as a framework. So there's going to be some local on the ground work, but we are going to be able at Mental Health Colorado to provide some kind of targeted short-term technical assistance, and then sort of our goal is to back off and let communities kind of do their thing, but to offer them a framework in which to do that. And then the third component is toolkit expansion. So we're going to expand the toolkit to include more robust resources and best practices on substance use prevention. We're going to develop some cost modeling to help school districts estimate the cost of implementing best practices in their communities. And we're going to look at that in sort of rural school districts as well as urban school districts, because there are probably going to be some cost differentials there. We're going to do some web and mobile optimization of our school mental health toolkit so that it's more kind of user-friendly on mobile devices. And we're going to identify and map indicators of school-age mental health. So this is actually, I'm pretty excited about this one. So we have, we're going to develop, I don't know if you're familiar with this software called ArcGIS. If you've seen any cool maps where you can sort of look at different kinds of metrics in a map, that's probably done with something called either ArcGIS or Tableau. So we're using both of those to do like a mapping of like things like suspensions and expulsions from school, overlaid with capacity of mental health providers in those school districts in those counties, overlaid with suicide rate. And so looking at sort of all of these various factors so people can kind of pick and choose how they want to look at them. So that's our other sort of expansion work that we're going to be doing. So it'll include an online mapping tool at the school district and county levels, and probably too at like the legislative level, so at like the House district levels as well. So people can kind of look at, what's happening in my district, and then who are my legislators, and what's the suicide rate, and how can I put all that together and be an advocate for these things. So ours is it's a 2-year project. So we think that's, we've already started to roll out the toolkit and implement it. So we think 2 years will be sufficient to get into all 178 districts in our state. I want to qualify that with, we're going to introduce the toolkit and the best practices to 178 districts. Whether or not they adopt it is kind of out of our control, but so far we've had only one school who has outright rejected it. It wasn't a district, it was one school that kind of outright rejected it. And I'm not going to say who the school is, but I will say what their reason was, because it was ridiculous. And it was, oh, students at our school are gifted and talented, so they don't have mental health problems. Yes, that's all I'm going to say. So I do want to say, though, that that's not true. So 178 school districts, 1,888 schools, and our public school system now supports over 900,000 students. So that's what our impact is going to be. We're going to look at the K-12 system, and I do want to mention too, we're also developing an early childhood mental health toolkit. So that's why I'm just talking about the K-12 system here, and that's what the Attorney General's grant was intended to fund. So this is our sort of our population to be supported by this. We're not doing direct work with students. Our direct work is with a sort of capacity building and systems building with districts. So our aim is for districts and schools to have a comprehensive approach to mental health. So for school, at the school district level, it would be to promote these best practices. At the school level, it's going to be to frame how they do this work. And at the individual student level, it's going to be how they receive these supports. What are the resources that students will actually have available to them? So those are sort of the levels of impact. And just really quickly, in case you're sort of, doubting where this all came from, there are sort of three influencing factors in this. One is the CDC has come out years ago with this whole school, whole community, whole child framework. And it makes a lot of sense. It's essentially, schools can't do this alone. Schools need to be part of the communities, and the resources that schools have available to them also need to be community resources as well. So things like community mental health centers, doing some sharing of resources and professional services with schools or school-based health centers, and not assuming that schools can do this alone, but looking at the whole child, the whole school, the whole community. We had a lot of community conversations over the course of about a year with across Colorado, asking, what do you need, what makes sense, what's working, what's not working. And then looking at sort of what the research showed, what are best practices, both in Colorado, what's working, what's not working, what has an evidence base, and then nationally as well. So those are sort of the design behind this, that influence the design behind these best practices. So the top school mental health best practices. So these are practices that that's either sort of evidence or research, or there's something behind it that shows that they can positively impact student performance and mental health. So in concert with others in the field, we developed a set of best practices that are based on sort of research, focus groups, expert opinion, experience, interviews with folks. So I want to go through those 10 best practices. And then wrap up with just sort of some tools that we developed for how school districts and community partners. So we hope that as I said, this isn't just up to schools. We really developed this toolkit for advocates in communities to partner with their school districts to help them implement these strategies. And we've got some tools to do that. So I'll wrap up with those. So the 10 best practices, the first is ensuring that mental health is a part of overall health and wellness. So as school districts are looking at nutrition and whether or not to put vending machines in the schools, or how much time should be dedicated to physical education or recess, or some of those things, or whether to start a running club, and that mental health should be a part of those conversations and mental wellness. So it's not just about nutrition and PE, that it's also about, maybe they could, embed some mindfulness into what they do in schools, or, ensuring that sort of there's a safe place where students feel they can go if they're having a particularly difficult day, or so including mental health as part of those conversations. The second is screening, identification, and referral systems. So this is probably, if there have been any of these where there have been and I wouldn't even call it resistance, but more just sort of some questions or challenges on how to do this. So this is probably one of those areas where we've received some of those questions. So we're looking at whether or not districts can implement sort of universal social, emotional, or mental health screening practices. And there are some districts who have done that using some very simple tools. Like there's one called the DESA, the Deborah Early something assessment. I don't think that's really what the two S's stand for, but it says the Deborah assessment. And then there's also one called the BASC-2-BESS, which I know the Aurora Public Schools had been using. So there are some simple universal screening tools, but I think districts feel that one of the complications, and this is where sort of, anybody who feels that they can be an advocate with their district, to help them understand that we can't, just because, so districts are a little bit concerned that if we identify, we have to do something about it. And yes, that's true. And concern about something called the Claire Davis Act. Some of you may be familiar with that, and particularly this week, because I think 2 days ago was the anniversary of the shooting of a high school student named Claire Davis. And there had been some possible kind of warning signs before that happened. And so there was an act passed called the Claire Davis Act. And so some concern about, well, if we screen, then aren't we then liable for what happens? My challenge to that, and hopefully you all can have the same sort of challenge to your school districts if you're talking to them, is, but if you don't do that, aren't you still sort of, I mean, isn't there still some responsibility? So if you don't do that, if you don't screen, so if you don't know about it, I mean, it's kind of like this, like, if I don't know about it, maybe it'll go away, which is not true. If you don't know about it, there's less of a likelihood that something can be done about it. So the third is social emotional learning and resilience. We really are encouraging schools to embed social emotional learning either as a class, which some school districts have been able to do. My kids go to school in Jefferson County, and Jefferson County has hired, Jefferson School District has hired, I forget how many, but it's enough social emotional learning specialists, so not clinicians, social emotional learning specialists to cover every single middle school in the district. And so my daughter, who's in 6th grade, so in one of those middle schools, actually had as one of her electives a social emotional learning class, and they were able to do that. But if it can't be offered as a class, at least finding ways to embed it into the academic curriculum. So there are ways to embed social emotional learning into math and science and social studies. The next is stigma reduction. So we're encouraging districts to look at ways to not just hang signs on the wall or do an assembly, but to really make reduction of stigma and sort of normalization of the conversation about mental health and mental illness part of an overall strategy for how they do their work every day, and not just, we did an assembly, so we've reduced stigma, because those don't work. Positive behavior interventions and support. So this kind of relates to climate and culture, sort of districts creating sort of climates and a culture in their school of sort of having expectations about behavior. You know, what are the rules? What's accepted, what's not accepted, and and the PBIS goes beyond just what are the rules, but sort of, you know, setting that climate and culture so that kind of expectations are understood. So then the 6th is school-based health centers to support mental health. So Colorado has over 50 school-based health centers, but think about that though, that's covering, you know, over 1,800 schools. So we still are under-resourced in school-based health centers. So these are centers that are not run by the school, but they're located in the school to provide health and behavioral health services. The next is partnerships with mental health professionals. Encouraging memorandum of understanding with a community mental health center, or finding ways to use community resources. And a particularly good example of this, I think, is encouraging schools to better make use of our Colorado crisis services, because I think sometimes schools or school districts feel kind of isolated from those community services that are available. So really, you know, ensuring that they know what's available in their communities around crisis services. And often schools are using Safe to Tell, which is an anonymous text line. So the next is teacher wellness programs and supports. We're encouraging schools to have as part of their mental health framework for their schools to make sure that their staff are well. Because if their staff aren't well, either, you know, through vicarious trauma or, you know, whatever, or just if they're just not, their own mental health and wellness isn't taken care of, they're not going to be able to most effectively support the students that are in their classrooms. The 9th is trauma-informed practice. Certainly not expecting that every teacher, every cafeteria worker, every bus driver is going to be a trauma-informed clinician. That's not what we're saying, but there are certain things about trauma that everybody should know. And so we really are encouraging like schools to have trauma-informed training as sort of part of their, and I think Partners for Children's Mental Health is going to be helping out with some of this, to really ensure that anybody who works with kids understands trauma and can really sort of understand when that student walks into their classroom or walks onto the bus, that we don't know where that kid has been or what's happened to them, and so we need to sort of provide supports in a way that you can support that. And then last is suicide prevention. So that can be through, you know, something like sources of strength or signs of suicide or something sort of actively in place that can support suicide prevention. So these last couple of slides are the tool that, that we've developed to help school districts and schools assess kind of where they are. And this checklist is really intended to be kind of a collaborative team effort, not sort of one person, like the school psychologist kind of filling it out, but really to help start the conversation about what's available and how the school or district might want to prioritize. So this is, again, downloadable in the toolkit. Take it, use it. We've got a sort of an assessment scale. So schools can, or at the district level, can identify, you know, are we not doing this at all? Are we doing this, but could use some improvement? You know, are we doing this, but it's not kind of formalized? And, you know, all the way up through, we're doing this, we have a way of evaluating it, and we have a sustainability strategy for keeping it in place. And then from that, they can find out sort of what's missing and then identify maybe one or two best practices that they want to focus on and implement, and really sort of either dedicate funds or time to working on over the next year. Or it might take longer than a year, but we're hoping like within a year that some of these can be implemented once they've identified them. So I'll stop there. Here's my contact information if anybody wants some more detail on the school mental health or kind of what our strategy is going to be now that we have this additional funding. But I would particularly encourage you to reach out to us for if you know of school districts or have good connections with school districts, and can help us get this toolkit, get this comprehensive framework of best practices into schools. So that's our work on this, and now I'm going to ask Antonia to come up here and introduce herself and talk about some of the strategies that Partners for Children's Mental Health is going to be working on over the next couple of years through this funding as well, and probably helpful to just give an overview of Partners for Children's Mental Health if you didn't already plan on doing that. Great, thanks.
Who are we, right? Introduce myself.
They probably can't hear you. Yeah. So hello, I'm Antonia Orozco. I'm the training director for Partners for Children's Mental Health. I'm also called Tony. I have no preference, so whatever works for you. Yeah. That's how, yeah, you know, I come from somewhat traditional family, right, where you have the big long name and then you have a million nicknames, right? So I answer to a lot of things. So I have the pleasure of being your final speaker today. So I'll do my best to be as engaging as possible because I know you all have been listening attentively for a long time now. So I very much appreciate the chance to be here to speak with you. If you have questions throughout the process, please interrupt. You all have a very specific focus, and I want to make sure that whatever I'm talking about really connects to you. So please bring that in. So I feel like my goal here is to talk about Partners for Children's Mental Health's role in trying to increase the capacity here in Colorado as it relates to children's mental health. The second goal I have is to share how that work is really going to be translated with the work of the grant that we received through the Attorney General, and then more specifically about the opportunities that we have to really align and partner with Mental Health Colorado. So who are we, right? What is Partners for Children's Mental Health? Yes. I fidget a lot, so I'll do my best to sit still. There we go. Okay, so who are we and what is Partners for Children's Mental Health? The way to think about us is we are kind of a cross-systems resource training and implementation hub, right? So we try to, we are building ourselves in such a way to be a partner for any stakeholder that is invested in children's mental health, right? And so that is because we are driven by a mission to improve mental health outcomes for children and families. We are driven by some very important values, things like partnerships, humble expertise, creativity, and translation, right? Taking ideas and really bringing them to a place of action and impact. Sarah did a really amazing job of framing the state of mental health in Colorado. When we first started, we're a fairly new organization. We've been around about a year. That was one of the statistics that really stuck out the most for us, right? 48th in the country. We want to be number one, right? And so Partners for Children's Mental Health, we dream big. And so, our aspirational goal is to get us to 10. So there's lots of different ways to do that. There's many needs in order to get there. So we're going to talk a little bit about what it is that we actually do. Okay. So really, as an implementation and training hub, we want to sit in a place where providers, state folks, youth and families feel like they have a resource that they can really connect with that doesn't have a lot of strings attached, right? And so how do we increase the quality of services here in Colorado and be kind of this neutral, supportive resource? Some of that has to do with increasing availability of evidence-based practices. This is often a big piece of any quality improvement solution. That's going to require increasing research on promising and informed practice and really thinking about implementation. We know now that if we don't apply principles of implementation science to any evidence-based practice implementation, that the sustainability is just not going to be there. And so the outcomes are not going to be there. And so we need to think about how do we actually sustain these programs over time for them to make a real impact. A lot of this has to do with creating connection. It has to do with thinking about how can we build capacity within respective organizations, within our agencies, across systems, and for the state as a whole. That has to do with building sustainability and supporting those processes. So it's not just about coming up with a solution and then getting distracted by another one, but how do we sustain what we know works over time? And all of this for us really needs to be driven by the child, youth, and family voice. We want to make sure that whatever thing we are thinking about, that we are constantly in alignment with that perspective, and we are bringing that knowledge into action. So how do we do that? We are a Center for Excellence, and these types of centers that are really devoted to improving mental health for states really need these specific core functions. And we are not the first to come up with this. This is an idea that actually comes out of Baltimore, Maryland. There's the Institute for Implementation and Innovation, and they come out of the Maryland School of Social Work. They were asked by their state cabinet, their state children's cabinet, to fix the mental health system. And so, they thought, okay, we should start with implementing evidence-based practices, right? Like that's how we're going to improve quality care. You really quickly come to realize that that's not enough, right? You need things like implementation science and research and evaluation to really sustain evidence-based practices. But none of that works if there's not partnership and collaboration and communication within organizations and across systems, because we all know that children they are complex individuals just like all humans are, but they live within complex family systems and they touch a lot of systems. So we can't just think about, the mental health system. We have to think about schools. We have to think about communities. And we really want to think about all of the state serving systems. And so if we're really going to affect change, we really, really want to think about how do we build cross-system collaboration. But even still, you do all of that. If your state is only funding you for 3 hours of that evidence-based practice and it takes 5 hours to do it to Fidelity, you're still in a pickle. So that's where the policy and finance arm really comes in. We need to be working kind of at all levels of the system, from families and youth all the way to state legislators, to try to build a system here in Colorado that is going to meet the needs of children and families, not the needs of the service providers, but what the needs are of children and families themselves. All right, so I mentioned that we've only been around a year. We're pretty new. We're still figuring out how to develop in a way that really supports Colorado. And what we've learned is very validating from how we originally started, imagining what our role here in Colorado would be. But we hear over and over again how important it is to learn from what's already been tried and to build on what works. Many of you in this room have probably experienced the fatigue of trying to improve things and trying new things. And if we don't keep that thread of what we know works, we end up spinning our wheels a lot. And so we don't want to be an organization that promotes one and done ideas. So Sarah, you talked a lot about just this, the screening of the week, or, there's lots of different programs or models out there that people are promoting, and it can get, I think, exhausting for actual leaders to identify what really they should be doing and what's really going to make a difference. And so we're very much in alignment with Mental Health Colorado around avoiding these kind of one and done program strategies, but thinking about how we can actually reduce duplication and increase collaboration, right? So if we know what everybody is doing across the state, things like the mapping project you mentioned is just so exciting, right? Because if we can really identify what's happening and where it's happening, then we can get more of that historical information, and we can learn from what the data shows us, and really take what's worked in other places and implement it in other areas throughout Colorado. So it's really about that increasing of collaboration and reduction of silos. We want to, again, avoid that one and done programming. So what about the solutions can we bring forth that we can spread and scale across Colorado and make things available to people? All of this, of course, needs to be data driven, so that we know what we're doing works. Another piece that's really important about what we do and how we think is the system of care model. I could spend hours talking about it, and but I think what's important to note about system of care is it is really about system building. It's about system change, and it's about doing it in a way that is culturally and linguistically competent, community-based, and youth and family driven. And so we really are learning constantly how we can think and do that better. But really want to align with anybody and everybody who sees the beauty of things like building natural supports and thinking about, developing innovative solutions that give people services that are in the least restrictive way possible. I don't know why I can't say that word today. But thinking about things like coordination and strengths-based, these are all pieces that I think, regardless of where you work or where you live, those are values and ways that we can think about solutions that work for all of us. Probably one of the first pieces that important opportunities that we've had to really increase capacity here in Colorado is the Roadmap to Children's Behavioral Health. Some of you are probably aware of this and maybe even received the report, but it was an opportunity for us to develop a statewide strategic plan for school-age children struggling with behavioral health issues. The reason for this was really timely. We understand that there was no plan for this particular age group, and that there was a need for a statewide plan, but also to do so now so that we don't lose all of the hard work that's already been done around these topics as we move into the new administration. I've actually brought copies of that if you are at all curious. I just want to highlight it here because I think it, again, helps to create a sense of understanding about how we try to approach things. So we took the system of care primer, which essentially says that if you want better services, if you want a children's mental health system, you need to think about things like governance and finance, effective care coordination models, building a service array that is comprehensive and addresses the actual needs of children and families, that really promotes quality, continuous improvement of evidence-based practices and other models. And then, of course, we have to talk about the door. If families are really immersed in a community where there's a lot of stigma, if there is a way in which they try to access services and there's really not a clear understanding of the difference between what a child's needs are and adult's needs are, it's going to be pretty hard to get that person into any kind of engagement that will actually result in consistent care and quality outcomes. And so we need to be thinking about all of these different pieces. And so we brought together a wide array of cross-system stakeholders to identify some recommendations, but still we want to honor the history, right? So we did this by actually pulling in recommendations from previous reports so that when people sat down and really started problem solving and coming up with goals, they already had a historical reference and we weren't just reinventing the wheel. So that's just one way in which we are trying to set the stage for increased capacity here in Colorado. A number of goals came out of that. One of that is the goal for a children's governing body. The understanding here is that if you have an entity that has responsibility for children with mental health issues as a population, that has responsibility for those cross-systems functions, you are better equipped at being able to help those children so that they don't fall through the cracks, right? And that's something that we see all the time. And so by in trying to build some legislation around something like this, we have an opportunity here to really start building more cohesion and collaboration within our system. So there's actually a meeting happening, I think right now, with a bunch of folks who are building that legislation, and that's a direct result of the work group process. We will be taking on some of the goals within the strategic plan, and so will Mental Health Colorado and a number of other stakeholders that, again, are here to partner in service of better mental health for children and families. So any questions about that are welcome, but we hope a lot of what comes out of this group will continue to build and address the gaps here in Colorado, such as our service array. So another piece that I want to bring in now finally is to talk a little bit about the Attorney General's grant. It was a very exciting opportunity for us. We were so excited to hear that we were awarded this Attorney General grant. And really what we need to do with that grant money is really think about how we can build capacity through a number of different mechanisms that we are entrusted to work through. One piece of this grant is the Zero Suicide Care Pathway for Pediatric PCPs. I'm going to focus a little bit on this one because what I want to do now is draw the connection between building capacity here in Colorado and the scopes of work that we have before us, specifically related to the Attorney General. So, one of the things that we're excited to do is work with the Education Development Center. They are the implementation arm of Zero Suicide. Has anybody here heard of Zero Suicide before? So they're a national model that is really built around implementing an entire strategy for reducing zero suicide in systems. And so they talk a lot about the things that we often talk about in terms of implementation and change, which is leadership, development, training, effective screening tools, helping people build communication and coordination efforts and communication with the people they need to refer to. So it's a very comprehensive model. It's comes out of the Action Alliance, which is a federal organization. But all of their work has been very adult focused. We see this a lot, right? They have amazing tools for mental health centers to implement zero suicide. They have just done a lot of really significant work, even within PCPs, building care pathways in those types of settings. But they really are just stepping into how to connect their work to the children and youth and family population. And so we're going to work together to try and build a care pathway that will help pediatricians better create a culture within their organization where they can actually identify youth that are suicidal and build a pathway to connect that child and that family to the services and supports that they need. So we will be really utilizing a lot of the AG grant funding to build this model. And then true to our mission, we will be figuring out how we can scale it and bring it across Colorado to anybody who wants it. And that's not something that we're going to charge pediatric clinics to do. So that's one example. We will be working in collaboration with Mental Health Colorado around the school mental health toolkit. It absolutely aligns and connects with all of the work that we want to do around preventing suicide in schools. And we're really excited to figure out what that's going to look like over time. Because we really want to make sure that we're supporting all the work that's happening without actually adding to the noise, right? I think a big piece that's exciting to point out that is coming out of this AG grant is the service array assessment. There are pieces of this that have been initiated really by the Office of Behavioral Health, but we will be taking on other pieces to really expand our knowledge of what the service array really looks like in Colorado. It's really hard to make decisions about how to build capacity if you don't really know where the gaps are. And so we will be looking at things like access and wait times. We will be looking at just availability of providers, but also what clinicians need, what providers and people who are actually doing the work really need in terms of training. So we understand that and build our training hub and our implementation offerings around the need. Part of what we think will be an important solution, and the last thing I'll talk about before I see if there are any questions, is PracticeWise. This is another project that we will be rolling out with the help of the funding from the AG. And what it really does is pulls together lots of evidence and connects it for the clinician to the person sitting in front of them. And so it's a way to access a lot of those evidence-based methods without having to spend money on 5 or 10 evidence-based practices to implement it within an organization, which is just, it's not possible. I came from a community mental health center, and I was a training director there and had the wonderful privilege of trying to implement 3 or 4 evidence-based practices at a time. And it's really not fun. And it's very taxing for the people who are really trying to do the work. And so we're hopeful that something like PracticeWise will be a more economic solution while maintaining evidence. And we really see that there's some real potential in rural communities specifically, because we know that it's very difficult. There's huge workforce shortages and not a lot of funding and supports for clinicians in these areas. And so this might be a solution that they can really hold on to and sustain over time. So those are just obviously you can see there's a lot of other things up there. I'm happy to answer questions about any of them, but I will go ahead and at least pause there and see if folks have any questions or comments. Hi, Ashley. Yes.
Just given the conversation that we had this morning about high fidelity wraparound, I think it's also worth noting that we have developed the training, coaching, and credentialing process for high fidelity wraparound staff, which will be housed at the Partners for Children's Mental Health through the Cross Systems Training Institute there. So they're involved in a lot of the work that we're doing through the Office of Behavioral Health.
Thank you. Yes. Carol.
Have you engaged with the SIM people?
I believe I'm going to be meeting with them next week, actually. We've been meaning to for a while. There's a long list of folks that are in this space that have a lot of knowledge and experience that we want to gain from. And so I think we're going to talk to them next week, and specifically about the pediatric care pathway. We're hoping they'll be on our steering committee. Yes, yes.
This is for both Sarah and for Antonia. And you know, I applaud you for doing this program, but I'm having a lot of trouble with understanding some of the scope. You know, like, you've got the funding, so are you bringing in the providers? Is that, you know, that's the side that they're talking about with the children's partners for children's? And then Sarah, when I think about my child's school, in a classroom of 30 kids, you know, any little bit of acting out, you know, can result in punishment after punishment after punishment, that eventually the child will have mental health issues, because the socio-emotional adjustment just gets worse and worse and worse over time if you're always being targeted. So, and it's not the teacher's fault necessarily, because she's one person or he is one person in a room of 30. And how are you going to, you know, address all of those issues? And I think, as I'm just looking at my son, for instance, I can see the 6-year-old turning into a 12-year-old that will have issues with his self-esteem, with his adjustment, with his connections to other people. I feel like there's that whole side of, you know, things that, you know, it's not your problem. I totally understand it, and I applaud this program, but there's some of these things that are going on that are just systemic issues that will present a wave of, you know, children coming out of a system that creates the problems almost, you know. And then number two, there's this issue that I see, at least, is that we've got children that will that are substance exposed, that are coming in, and trauma, you know, because if you think about our foster children that are hidden in the system, they have real serious reactive attachment, they have trauma, they have neglect, they have all these things that are mental health related and that are going to be issues. And, you know, I really think the program needs more expansion. You need more resources, because we're not getting the resources to the school, but we're, you know, it's like this huge wave, tsunami of, you know, things that are coming off that I hope you're able to make some good progress. So, you know, no problems with the program, but I'm urging you to think even bigger if possible, and think about some of the things that are going on for our children here.
I really appreciate you bringing that up. I think the problems are just, it's so dynamic. There's so many different factors, and I really urge folks to keep an eye out for legislation regarding a children's cabinet, because I think that is one area where we really can have some potential. If we can get a cabinet or a commission in place that can look at these problems more holistically, then we have an opportunity to advocate for legislation that will result in more funding and will think about things in a more holistic way, and thinking about school climate, but also community and culture and all of that. Because I agree, the problem is here, and this is like a little small piece that could help. And so I think we're just at the beginning of what has been a long-standing problem. It's going to take us some time, but what gives me hope is that so many of us are kind of coming out and having these ideas about how to think more strategically and systemically about solving these problems. There are other states that have solved these problems. New Jersey is one of them. And so, you know, that gives me hope too, that other states have addressed their system in a way that really results in better outcomes for their children and families. And so we just have to hold on to that and do what we can. I appreciate you bringing that to light. Yeah. Anything else people want to share or comments to make? I mentioned that we're a very new organization. We are designing ourselves in a way that is really meant to be a support for Colorado. So if you have ideas or opinions about how we can do that or how we can do it better, I love meeting with people and having these kinds of conversations. So please grab a card, and I'd be happy to talk more with you about it. Again, thank you for your attention at the end of a very long meeting, and thank you for all the work that you do.
Well, as Antonio said, and others have said, we've had a very full morning. Appreciate your hanging in there with us for the program. Just a reminder that the next CANDO will be March 8th. We're timing, at least right now, thinking of CANDO in the frame of the 10-year strategic plan around autism, which, given when the plan got started, would actually take us through June of 2020. So we do look to continue these meetings always, and everyone is welcome online, here in the room, and would appreciate hearing from people if there's particular topics that you want covered. So again, thank you. Thank you to our speakers. Everyone have happy holidays and hope to see you in March. Thanks.